New research sheds light on long COVID, how long it could last, and how many people could get it. Joining us now to talk about that, Dr. Jorge Salinas with Stanford Health Care. Good to see you. Thanks for joining us.
Glad to be here.
Well, it turns out quite a few people may end up getting some form of long COVID.
Yes, that is correct. I think that we've known about it for a long while, but there was a recent report from CDC that confirmed using data from 2021. So that just emphasizes something that we've been saying all along, which is that it is still worthwhile trying to avoid getting COVID-19.
And let's turn to vaccines for children. Pfizer says its vaccine is 80% effective in children 6 months to 6 years old, at least according to early data. If that holds up, how soon could we see vaccines for younger children?
I'm not fully familiar with the timeline, but I think that the federal government will try to move relatively quickly on this. So I would expect it in the next 1 to 2 months.
Okay. And there have been reports as well that some people who took Paxlovid have seen their COVID symptoms make a comeback. Should that raise concerns for anyone who might be taking it?
Well, what that means is that we need to, as always, be judicious in determining who should get this medication. This medication was initially studied on people who were not vaccinated at a high risk of developing severe disease, and it's probably among those people at high risk that it should be used. If you have taken it and have experienced rebound symptoms, it is recommended to continue isolating for another 5 days and then continue wearing masks afterwards to complete a 10-day period from the reinitiation of symptoms.
And finally, Dr. Salinas, should we be as concerned about monkeypox as much as COVID-19?
No, not at all. Monkeypox is a serious illness for sure, but it's not as transmissible as COVID-19. There have been a few cases identified in multiple countries potentially related to some social events, and providers, clinicians, doctors, etc., need to be aware of the manifestations of this disease. But I don't suspect that it will spread throughout our community.
And one more question. Any other message you want to get out there to the people just as we continue to fight our way through this pandemic?
The message should be that we need to keep an eye on the incidents in the community and up or down our game in terms of prevention, depending on how much COVID is circulating. As cases continue going up in our community right now, it is time to continue wearing masks, being judicious and mindful of our social interactions, trying to avoid crowded indoor spaces if you can.
Dr. Jorge Salinas with Stanford Health Care, thank you so much.
Thank you.